Where does the measuring tape rest while measuring the waist circumference? A. At the widest part of the waist, below the iliac crest. B. Directly above the bottom of the rib cage. C. Directly below the navel, in line with the top of the iliac crest. D. At the narrowest point of the waist, below the rib cage and just above the top of the iliac crest. Which of the following fits into the training industry's niche? A. Private gym. B. Small group training. C. Women's fitness. D. Independent contracting. Which phases should be used in a training plan for a client who wants to lose body fat but not gain lean mass? A. Phases 1 and 2. B. Phases 1, 2, and 3. C. Phases 1 and 3. D. None of the above. What category of joints would you classify the shoulder under? A. Non-synovial. B. Pivot. C. Ball and socket. D. Condyloid. A client who has been training for 6 months and is now pursuing their fitness objectives without a trainer's help is at what stage of change? A. Contemplation. B. Action. C. Preparation. D. Maintenance. What are the likely overactive muscles if your client's feet turn out during the overhead squat assessment? A. Lateral gastrocnemius. B. Erector spinae. C. Tensor fasciae latae. D. Hip flexor complex. What is one way that good posture can be a sign of health? A. Correct posture improves the ability to reach. B. Correct posture adds length to the spine, increasing height. C. Correct posture encourages altered movement patterns. D. Correct posture ensures that muscles are at their appropriate resting length. Which exercise pairs a lunge jump with a barbell squat? A. Power training. B. Balance training. C. Hypertrophy training. D. Maximal endurance training. What range of repetitions and weight percentages are most effective for training muscle endurance and stabilization? A. 1 to 5 repetitions at 85 to 100% of 1 RM. B. 12 to 20 repetitions at 50 to 70% of 1 RM. C. 1 to 10 repetitions at 30 to 45% of 1 RM. D. 6 to 12 repetitions at 75 to 85% of 1 RM. The stabilization level of training would be most represented by which of the following? A. Building muscle. B. Intramuscular coordination. C. Intramuscular coordination. D. Explosiveness. How is realistic defined in SMART goals? A. The goal is something the client is capable of doing. B. This type of goal is completely new to the client. C. The trainer is sure the client can achieve the goal. D. The client is both willing and able to work toward the goal. What would be the definition of the attainable part of SMART goals? A. It means the goal is easy to attain. B. It means the client will definitely succeed. C. It means it is possible that the goal can be achieved. D. It means the goal is challenging but reasonably accessible. What must a person do in order to complete the R of the goal-setting SMART acronym? A. Make the goal challenging, but not extreme. B. Decide on a specific date of completion. C. Make sure the goal can actually be achieved. D. Establish a way the goal can be quantified. Which of the following is subjective fitness assessment information? A. Postural assessment. B. Cardiorespiratory assessment. C. Occupation. D. Body composition. In an examination of an overhead squat, which movement compensation is suggested? A. Knee adduction. B. Cervical extension. C. Scapular protraction. D. Shoulder elevation. In an examination of an overhead squat, which movement compensation is suggested? A. Knee adduction. B. Cervical extension. C. Scapular protraction. D. Shoulder elevation. What is a dietary supplement made from something other than food or medicine? A. Dietary supplement. B. Calorie. C. Over-the-counter medicine. D. Beverages. What is it known as when a synergist replaces a weak or inhibited prime mover, such as when the hamstrings replace the gluteus maximus? A. Muscular failure. B. Reciprocal inhibition. C. Arthrokinematics. D. Synergistic dominance. How may the M in the goal-setting acronym SMART be applied? A. By making the goal quantifiable. B. By making the goal something they are willing and able to work toward. C. By not making the goal too challenging. D. By creating a timeline for the goal's completion. How many repetitions should a pushing or pulling be performed? A. Until it fails. B. Repeat up to 5 times. C. Repeat up to 20 times. D. Repeat up to 10 times. What position is the ankle placed in when wearing high heels? A. A dorsiflexed position. B. A supinated position. C. A pronated position. D. A plantar flexed position. Durability of stabilization training aims to advance: A. Rate of force production and power. B. Rate coding. C. Muscular endurance. D. Total volume of work. Which further certification is necessary for a NASM-certified personal trainer? A. NCCA. B. First aid. C. Undergraduate degree. D. CPR. How many calories does protein provide per gram? A. 6 calories per gram. B. 10 calories per gram. C. 4 calories per gram. D. 8 calories per gram. Which of the following components of a human cell is regarded as an organelle? A. Lysosomes, ribosomes, endoplasmic reticulum. B. Neurolemma, Schwann cells, sarcolemma. C. Interstitial, mucus. D. Neurons, cell wall. The exception to the list of behavioral strategies is A. Self-management. B. Positive self-talk. C. Self-monitoring. D. Goal setting. What percentage of adults suffer from musculoskeletal lower back pain? A. 75%. B. 80%. C. 19%. D. 35%. Which of the following describes a component of at-home private training? A. The trainer is paid an hourly wage with benefits. B. The trainer must travel and use portable equipment. C. The trainer pays a fee to a health club in order to train clients. D. The trainer owns a facility and is responsible for facility ordinances. Exercise science covers a broad range of the following topics except A. Athletic performance. B. Scientology. C. Physical activity. D. Exercise. How many calories per day should come from carbohydrates? A. 30 to 45. B. 20 to 30. C. 45 to 65. D. 65 to 80. Does exercise impact anxiety and depression? A. It does not improve depression or anxiety. B. It improves anxiety, but not depression. C. It improves both anxiety and depression. D. None of the above. What is the best SAQ assessment drill for clients who are trying to lose weight? A. Stand up to figure 8. B. LEFT drill. C. Jump squats to box. D. High-intensity circuits. The Dernan formula uses all of the following skin fold measurement sites, with the exception of A. Triceps. B. Subscapular. C. Midaxillary. D. Biceps. Blood vessels that carry blood from the heart to the body's other organs are referred to as A. Atria. B. Veins. C. Arteries. D. Capillaries. Which definition most accurately defines the frontal plane? A plane that splits the body into equal vertical sides. B. A plane that splits the body into upper and lower halves. C. A plane that splits the body into front and back. D. A plane that splits the body into 4 sections based around the arms and legs. Which of the following blood pressure measurements would be affected by the ventricles contracting and driving blood into the pulmonary and systemic circuits? A. Diastolic blood pressure. B. Systolic blood pressure. C. Ventricular diastole. D. Arterial systole. All of the following are obstacles to building rapport, with the exception of A. Asking probing questions. B. Interrupting too often. C. Being disinterested. D. Not being an active listener. What is one of the likely underactive muscles if you notice your client's lower back arches during an overhead squat assessment? A. Sternocleidomastoid. B. Hip flexor complex. C. Gluteus maximus. D. Latissimus dorsi. Which of the following evaluations is most suitable for an obese person? A. YMCA 3-minute step test. A. 1RM test. A. Rockport walk test. A. Single leg squat assessment. Which type of joint would the elbow be considered? A. Hinge joint. B. Rolling joint. C. Gliding joint. D. Spinning joint. BV is a protein quality metric that measures how well a protein meets the body's essential amino acid requirements. The letters BV stand for A. Body value. B. Bovine. C. Biologic value. D. None of the above. The phrase that best sums up the number of blood beats per minute multiplied by the quantity of heartbeats per minute is A. Stroke volume. B. Cardiac output. C. Diastolic blood pressure. D. Systolic blood pressure. How can self-talk that is constructive help clients succeed? A. It allows the client to succeed. B. It has no effect on client success. C. It forces the client to embrace exercise. D. It improves the client's belief in their abilities. What is a methodical approach to assessing a client's structural and functional status? A. Fitness assessment. B. Variable selection. C. Perform nutritional counseling. D. Diagnose conditions. What kind of information does a fitness assessment provide? A. Details about one's level of activity, hobbies, and abilities. B. A representation of the client's objectives and requirements. C. Medical history and health-related information. D. All of the above. Which category exemplifies potential upper cross syndrome injuries or conditions? A. Headaches, posterior tibialis tendinitis, low back pain. B. Plantar fasciitis, posterior tibialis tendinitis, patellar tendinitis. C. Hamstring complex strain, anterior knee pain, low back pain. D. Headaches, biceps tendinitis, rotator cuff impingement. Which of the following three phases does strength consist of, according per the OPT model? A. Stabilization strength training, strength endurance training, power endurance training. B. Strength endurance, hypertrophy, and MST. C. MST, hypertrophy, power training. D. Power training, strength endurance training, hypertrophy training.